for joining this Zoom conversation. I'm State Senator Barbara Favola, and happy to host this. I know that many of you out there have some concerns and some ideas on how the Fairfax County Public Schools should proceed, both over the summer and with their reopening plan in the fall. I'm delighted to say I've got a panel of folks who can add some insight. Happy to hear from your thoughts, and perhaps we can move our conversation towards a fruitful end. First with us is Holly Coy, and Holly is the Assistant Superintendent for Policy, Equity, and Communications with the State Department of Education, and Holly has been intimately involved in the process by which the state came up with guidelines for opening the public schools. Of course, these are guidelines. The state wants to work very much with our local school districts. We consider our local school districts to be partners, strong partners in the education of our children, and we want to be there to help. I also, Elaine Tholen, who is a newly elected school board member from the Drainsville district, and you were a science teacher, natural science teacher, and you bring a lot of wonderful skills to the school board, so thank you for joining us.
Absolutely, thank you.
And then my colleague, Kathleen Murphy, is on the screen as well, and Kathleen is a delegate in representing the western part of my district, so Kathleen's delegate districts in my Senate district, and I also have Arlington and other and other portions, yeah. And also Dr. John Whyte, medical doctor, Dr. John Whyte's joining us. And John, you are on the task force that Fairfax County Public Schools set up to think through the process for reopening. And you're also the Chief Executive Director of the WebMD project, right? We can't hear you.
WebMD for info. Did that work?
Yeah, that's better.
How about now?
That's perfect. I'm going to ask Holly Coy to make the first presentation, and then maybe I'll turn to Elaine, and then to you, John, and your two lawmakers are going to try to listen and add when we can, but we consider you three to be the experts. So Holly, go ahead.
Great. Thank you, Senator Favola, for having me this evening. It's a pleasure to be with all of you. My name is Holly Coy, and I serve as the Assistant Superintendent for Policy, Equity, and Communications at the State Department of Education. And this evening, I'm going to share a little bit with each of you about the announcement that happened this past week from the governor with the state's guidance for local divisions as they make plans for reopening. And as the senator mentioned, what the state has outlined is what we believe is kind of the best recommendation that we have based on the science, based on what the CDC has provided in collaboration with our partners at the Virginia Department of Health. But this is guidance, and so each of our local divisions around the Commonwealth will have to take this and think through and figure out how it applies to their community based on the local public health conditions, based on the local needs of students and staff, and the practical realities of school buildings and transportation and all the operational pieces. So the first thing that I want to note is that while we are in this strange pandemic and find ourselves with schooling looking much different than it did just 6 months ago, schools will be open for students in the fall such that all students will receive all the instruction next year. The expectation is that regardless of operational status, every school has to deliver all the content to our students next year. But we know that will likely look a little bit different than we're used to. So the Virginia Return to School Plan and Guidance focuses on scaling up opportunities for in-person instruction starting immediately, while addressing the health, the social, emotional, and the physical well-being of students and staff. It also seeks to prioritize the needs of our most vulnerable learners, while also building towards a scenario where we can serve all students in person. The plan is such that it outlines 3 different instructional phases, so to speak. These are aligned with the phases that the governor has been using for the gradual reopening of our businesses in the Commonwealth. And so most of Virginia, as of today, finds themselves in phase 2. Our plan does have parameters for phase 1, phase 2, and phase 3, recognizing that we're already past phase 1, but should there be spikes, we may need to return to phase 1. So we'll share a little bit about what those phases look like in an in-person instructional way, and then talk a little bit about some of the health and mitigation strategies that are expected of schools. So phase 1 requires instruction to be predominantly remote, but it starts to make some exceptions for in-person instruction for our special education programs and students. Phase 2 builds on that even further, and it begins to open up in-person instruction for preschool through 3rd grade students, as well as English language learners. It also opens up school buildings to summer day camps. So this is where we find ourselves currently, with these as kind of the recommended starting point for opening up that in-person instruction. Phase 3 then allows instruction to shift to include more in-person interactions and can go up to every student every day, but the school has to be able to accommodate some social distancing and physical distancing recommendations. So it's important to note that while that is the recommendation and the permissive, school divisions may kind of live into these phases in more gradual ways based on the local public health conditions. In all of these phases, the expectation is that there is 6-foot social distancing between students and teachers at all times. There are gathering limits based on the governor's executive order at the time. So for phase 2, the governor has placed a gathering limit of 50 people. And so it's important for mitigation strategies to limit crowds, but also to limit the mixing of classes or the mixing of groups of students. And so it's not just that we can't have more than 50 people in a cafeteria at one time, but also to the extent that each classroom can kind of be contained, that helps with any potential spread of COVID. In phase 1, there aren't any athletics or extracurricular activities permitted, but in phase 2, that begins to loosen up. So athletic competitions and skills training, conditioning can begin to happen in a very, very limited way. There has to actually be 10 feet of physical distancing between individuals during these activities, given the spread of respiratory droplets. And there can't be any shared equipment or balls or rackets or anything of that nature. And so there are some pretty severe restrictions on athletics, but they can begin to open back up, particularly for conditioning. There are some precautions that apply to all phases. The expectation is that our schools will be doing some sort of daily health screening with students and staff. That can take a number of different forms, and that's a big operational hurdle. But the expectation is that our divisions are navigating this. This could be temperature checks, but it is not limited to temperature checks. It could be a broader assessment of an individual's health on any given day. In all the phases, there's an expectation that divisions are creating some policies for remote learning or teleworking for students and staff who are particularly at high risk of severe complications due to COVID. And the CDC outlines pretty clearly what we know about who those individuals are. And we want to make sure that if accommodations need to be made, that our divisions are doing so. When it comes to the use of face coverings, our recommendation is that they are strongly encouraged, particularly among staff, and particularly when social distancing cannot be maintained. We know that the social distancing is a great mitigation strategy, and so we're also realistic about the use of face coverings with students and recognizing that both developmental appropriateness and medical appropriateness should be taken into consideration, both with students and staff. But the vision is such that if 6-foot social distancing is happening in a classroom and tables and workstations and desks are spread out and the teacher is somewhat distanced from the students, then they don't have to be wearing those face coverings throughout the day. But during particular parts of the day or transitions, when that distancing is not achievable, we know that's when those face coverings become more important than ever. There is kind of in addition to this guidance, there is an expectation and actually a legal requirement that all divisions submit health plans to the Department of Education. And this is coming from an order of public health emergency from our State Commissioner of Health, who has asked all schools, private and public, of any variety operating in the Commonwealth, before offering any in-person opportunities to students in phase 2 or in phase 3, they have to submit a health plan to the Commonwealth. And there's more information on our website about that, but this is an expectation that everybody will be creating these plans. These plans will address everything from social distancing, face covering policies, what the policies and procedures are when a student or staff becomes sick at school, and how those situations will be handled. Additionally, our public school divisions will be submitting instructional plans to the department, outlining kind of what the contingency plans are. Should there be a spike in cases? Should we need to go backwards? Should we need to adjust and pivot to entirely remote learning? We want all of our divisions to be prepared for that moment in case we need it at some point during the school year. This spring really threw our K-12 system for a loop. A lot of our divisions, frankly, hadn't had to be prepared for that type of experience previously. And so now that we have a little bit of experience in this, we've learned a lot this spring. The expectation is that our divisions will know how to pivot if we need to in the coming year. So that's a little bit about the state guidance. As I said at the beginning, this is guidance that was developed in collaboration with lots of our stakeholders from around the Commonwealth, along with the Department of Health, and is guidance for divisions as they seek to mitigate the risks while recognizing the very real instructional, mental health, and social emotional needs of students and staff in coming back to school.
Great, thank you. That's a good overlay. So I'm going to turn to Elaine, who's maybe going to enlighten us a little bit about what we could expect from the Fairfax County school system in terms of a plan of action.
All right, thank you very much.
Sure.
Yes, still lots of questions out there, but let me first address summer. We do have a lot of opportunities available for families to take advantage of this summer. On top of our, at present, I will note that all of our summer opportunities will be virtual opportunities. We had already put all of that in place, hired our staff, etc. You know, even with that new guidance that just came out this week from the governor that says we could potentially have some, you know, in-person summer school activities. We haven't planned for that, you know, at this point. So let me just have that caveat out there. On top of our usual programs that we have for the extended school year for our special needs students and credit recovery for our high school students that need to make up classes, we are also offering a continuity of learning program for all students K through 12, and through K through 8. All students will be receiving 2 workbooks, either mailed to them or will be available on our Blackboard system. And that booklet will contain 5 weeks of material. 1 booklet will be for language arts and 1 will be for mathematics. And then in addition to that, your individual schools should be getting in contact with you regarding office hours that teachers will have at those schools, so that you can access you know, the teachers at your home school for any additional help that you need in, you know, working with those materials or any, you know, other things that you're working on over the summer to, you know, keep your kids learning. So we also have iReady is available to our families through the month of July this summer. and that can be used as well. And same thing with our high schools. We will have staff available at the high schools for students that need additional help or that are working on some learning activities that will be available in our Google Classroom sites for our high school students. So that is just kind of a little capsule for summer. And then on top of that, we are, of course, heavy into planning for scenarios for the fall. And John can fill you in a little bit more too. He's been on our task force. I'm so happy to have him participating with us. But of course, as the state, our guiding principles for anything that we're doing in the fall, number one is to ensure, safe learning and working environments for our students and staff, but also to make sure that we are providing the instruction that our students need. So any virtual instruction that we have next year will be much more robust than what we've been experiencing this spring. And I think that will be good. Our families have really been asking for that. One of the things that we're working on as part of our plan is, of course, being a very large system geographically, is our transportation plans. So that is going to be a big part of what we're looking at too, in order to try to social distance our kids on the buses and figuring out that the best, safest way to get kids to school. We will be planning to, as Holly Coy was mentioning, we're planning to planning to teach all of our new material just as we would normally be doing for our various grade levels. And we'll be looking at, in the beginning of the year, different ways to assess and see what type of review our students will need because of the way we were learning this spring. We are anticipating in using our regular attendance procedures and our regular grading procedures in the upcoming school year. So, we're looking at a variety of scenarios depending upon what phase we will be in August. August 25th is our first day of school for Fairfax County. We're looking at, if we need to have a complete virtual system, can we open with social distancing, and what types of online learning do we need to provide both for students and for staff that for health reasons are not able to return to school. So to give you an idea of our planning timeline, we actually have our first presentation from staff to the school board on different scenarios this coming Monday at 1:30, so June 15th. And that will be a public meeting. It will be recorded. If you can't watch the meeting as it's occurring, you can look at that recording. It will be posted on YouTube on our FCPS YouTube channel. June 18th, which is also next week, we have just added a public hearing around return to school to our calendar. So people will have the opportunity to, you can sign up to speak at that public hearing. It will be at 6:30 p.m. on June 18th. In addition, we will have another school board work session to look at, taking input throughout all of next week, gathering information from staff. I'll explain additional ways people can get comments in, and then June 23rd, we'll have an additional work session that will hopefully incorporate all of that input as we move forward.
Now, this process is posted on the Fairfax County Public School page.
Yes, it's on our website, and I've got it out on my Facebook page, Elaine Tholen, Dranesville School Board, and it's posted in a number of locations. We also set up an email address, returntoschool@fcps.edu, and we are welcoming anyone to put out comments, ideas, questions on that mission address. So you can email us, watch the work sessions, attend virtually and speak at the public hearing, and all of this, as I said, will be public and live streamed. And tomorrow we will have a survey going out to all families and all staff members in a myriad of languages, asking questions about their various ideas and plans around what could happen in the fall. So we're trying to get some, numbers around different scenarios. So that's sort of our planning timeline. We are aiming for the end of June to have some, kind of, good idea of what we're planning to do so that we can prepare the reports that Holly Coy was talking about that we need to send to the state to make sure that they are okay with what we're looking at doing, and to help get the information out so that our families can plan and make their accommodations as necessary, and that our school-based staff can implement everything that we need to do.
Thank you. We're now going to turn to Dr. Whyte to hear about the Citizens Task Force. And I know one question that has come up, and maybe you can address this, Dr. Whyte, has been the need for extended day, because some parents will actually have to go to their workplace. They won't be able to continue to work remotely. So the extended day program is important to many people who are listening today. So I don't know if you're the right person to address it, but then
No, I may not be the right person
needs to get into the mix.
But it speaks to the broader issue of a school policy is also dependent upon a work policy for parents, that as more and more places begin to reopen, parents, and I'm a parent of 2 young children. I work, my wife works. We have the luxury right now of working at home, but that may not be the case, in late summer, as it is for many parents. So that's going to be a real issue of concern that we have to take into the broader context of health and medical, as well as the educational needs. And I know there's many folks that can discuss, health and medical, in the State Department of Health. And, I first also want to express my appreciation to Senator Favola for doing this and having this outreach, and, to our member, Elaine Tholen, who really is trying to get public input. And we know that there are, passionate people on multiple sides of this. It's not a square, it's like a polygon, with many sides, and folks are passionate. But here's what I would say in terms of perspective of what I'm hearing on the task force, as well as some thoughts from my role at WebMD, where I've been interviewing 100 experts over the past couple of months for a daily news show that we have coronavirus in context. And I think what's important for all of us to keep in mind is that we really want to be guided by science and what's the best available scientific advice. But here's the challenge that we have. It's a novel coronavirus, which means it's new. So there's a lot we don't know. And I know folks get frustrated because there's changing recommendations and changing information. And then let's be honest, there always hasn't been good communication at the national level. And to be honest, sometimes, at the state level, but people are trying. And the challenge has been, if you remember, at first we were told we didn't need to wear masks in facial moments. And then we were told that we should. And that's the conventional wisdom right now. Remember all the discussion about antibody testing, and we're going to have these certificates of immunity. And then we learned that we don't really know how accurate these tests are. We do think that the presence of antibodies confers some degree of immunity, but we're still learning about that. We've learned a lot more in the last couple of months about surfaces, and that's important for parents to keep in mind. The CDC has issued new guidelines about it's really the respiratory droplets, and that's why the social distancing is so important, because if I'm breathing on someone or very close to someone, I'm more likely to catch it than I am by touching a surface. That doesn't mean that it's impossible, but we need to focus as we think about how do the schools operate, particularly for young children, which I have. How do you balance all of these things? And, I mentioned to many of you, we have to look at the totality of information. So there's always going to be a new article about, okay, it's not 6 feet, it's, 18 feet, and I heard that on a recent, task force call. And the point is, we have to look at it, we have to look at the totality, and then really make the best recommendations that one can, and really ask, parents and others for the flexibility to know that these recommendations are going to change, and also recognize, as I think most people do, it's the teachers who really, and the support staff and others who are most at risk. Even though it happens in kids, it is still very rare. And we hear about those cases somewhat relating to a disease called Kawasaki, but it's still very rare in terms of the total number of cases. It's also, we have to protect teachers, the administrators, the support staff, et cetera. And something that we think about in terms of, how do we keep all this in mind is something I've been talking about, which is person, place, space, and time. Remember, we want to decrease social gatherings to no more really than 15 to 25 people. And how do you do that in the context of a crowded school? Outdoors better than indoors, but that's not going to work, in the fall and in the winter. It's about space, that 6 feet, distance. And the other element that we've learned, which is relevant, is it's really, 15 to 30 minutes of prolonged exposure. That's where you increase your risk. And the school day is a lot of time where people are directly, in contact with the same person, for 30 minutes. So, what I wanted to address is that, everyone's going to be able to find a journal article or a study to support, that the schools should open fully, or that the schools, shouldn't open at all. And there's going to have to be a middle ground. But what a lot of citizens have talked about on the school board, and I've talked to my, representative, Elaine, as well as you, is we need to have explicit criteria for parents and everyone to understand what are the guidelines to move from different phases. And we also need to have a phase 4, which means to go back to essentially what it was during pre-COVID, meaning perhaps the cafeterias are opening or that we can do other activities. We can't presume that it means 0 cases, because that's just not realistic. But what is that data point and data points that we're looking for? And we don't see that yet. And I'm sure folks are working on it, but that's what parents want to know as well. We can't be in this, phase 3 forever. And what I'd also say, I don't think we should tie it to the creation of a vaccine. And some folks have been doing that. Well, when we have a vaccine, then we can change everything. We shouldn't assume, despite what's in the news, that a vaccine is going to be available to everyone in the fall, that it's going to be demonstrated to be safe and effective. And what if it doesn't even occur in 2021? That's the history of vaccines, or there's some complication. We have to have a policy and a plan that allows a phase 4 at some point, but also tells parents what happens so everyone knows up front if there's a case. Does that mean you shut down the entire school for 14 days? So, that's what I'm trying to work through with the task force. Those are the issues that I've been hearing also from other parents, in my area, because there's a lot of confusing information out there. And I think we have to, give everyone the flexibility and recognize that recommendations are going to change over time. So, we're going to learn a lot more in the next 2 months about the virus, but we can't wait, 2 months to decide what to do. And that goes to Elaine's point. We have to have a plan, but then we also have to think through how do we modify that plan based on new scientific information, recognizing that, public policy also guides the final decisions, but we want to be guided by science. And the governor has talked about, we have good collection of data. We're not quite, exactly where we need to be in terms of testing, but we're doing better. And we want to be driven by data, and we want to look at data, and we want to look at the local community as opposed to necessarily the entire state of Virginia. And I want to, thank all of you for all the work that I know all of you are doing around the clock, on a topic that we never could have predicted, while still also doing all the other elements that our jobs entail. So, and I know everyone has the best intent in protecting students, protecting staff, really protecting the entire community. And, everyone's not going to be happy with, the final result, but it can be iterative as well. But I agree with the others. What I'm hearing on the task force is decisions have to be made soon. And you all have talked about that because parents like me and some of you want to know what are we going to do? Because if they're not going back to work, or they have to go back to work, that also changes how they manage everything. So they really need to know, is it an alternative day? Or there's some days they're not going to school? Is the time frame changed? What's the issue of, as you said, of extended day? And, how many people can that be? So I know there's an immense amount of work to do essentially over 2 months.
One question, and this is sort of a clarification for you, John. When you said explicit criteria, you meant explicit criteria for when we can move from one phase to the next?
Which we have some of that, yeah. Yeah.
But then you'd also need guidelines for actually implementing that next phase. So
I also meant like from phase 3 to go from phase 3, what's the phase 4? So the phase 4 means no social distancing, or, limited social distancing, no masks, cafeterias open. You no longer have to have one child on a bus seat. Do you know what I'm saying? Things like that. So it's really almost like pre-COVID. Somewhere that has to be in there. So you can't stay in phase 3 forever. I just don't think parents are going to be tolerant of that. So I meant, does it mean 0 cases, or
right. So some scientific,
there's some data point about cases and hospitalizations and testing and stuff like that. That's what I think that means. I don't think that means you don't change, cleaning up surfaces and stuff like that. And I'm not saying everything should go back to normal pre-COVID, but some parents are going to want to know, and it can't be tied to the vaccine. So that's what I meant in terms of criteria, in terms of cases. So what if there are no cases, for instance, and this has come up, but parents say, what if there's no cases for 2 weeks? None at all, like New Zealand. I'm not saying it would be like that. Then what do? I don't think we have a plan for that. You can't say, well, we'll stay in phase 3 until there's a vaccine, right? That's what I meant.
One thing we know for sure, though, is we're going to continue to evaluate.
Yes, but still,
situation.
Yeah, but just as there's phase 1 through phase 3, and it's not absolute. Do you know what I mean? It's based on the best knowledge at the time to say, well, what is phase 4? I mean, because, Senator Favola, I'll say, I think part of the challenge will be if people don't see cases, and I'm not saying that doesn't mean they occur, there's fatigue, people don't practice it, the safeguards. I mean, you only have some people practice it, it doesn't work well. And then we don't want to create, more problems. I just feel it's very important to have a phase 4 element, because otherwise it seems like we're in a purgatory forever. And I'm not saying that we don't stay in phase 3 for a very long period of time.
We hear you. We hear you. We'll take that back. I guess we have more work to do, Holly. Delegate Murphy, did you want to say something?
I just wanted to thank you, Barbara, for putting this together, because it's so important for this information to be available. Yeah. So I'm enjoying the conversation, and I appreciate your input. And so let's just continue. But thank you, Barbara, for making this possible.
Oh, thank you, Kathleen. I appreciate the partnership we have in Richmond. On the screen is my legislative aide, Julia Chun. I had neglected to introduce Julia earlier, and she is screening the questions that folks are submitting online. So I'm going to turn to Julia and ask you what's our next question.
So we've actually heard from several parents who are anxious to have a plan in place for additional support for their children. So here's an example. So this parent is reading that children with IEPs may be eligible for more in-school services than children without them in the early stages of reopening. And her question is, what will the IEP assessment process look like during that time? And should we assume it'll be expedited or protracted in reaching a conclusion?
That's a very specific question. I don't know if we have a very specific answer.
That is something, I am certainly willing to take back and do a little research on, exactly what our special education staff is thinking about doing, when children return to school.
And I should also mention that there are a broad range of questions about pre-K through second and third graders who have IEP, some more general questions, as well as those you know, who will be graduating in the next 1 or 2 years, so they're in high school.
The question before we move on to the high school students, I know that parents, and they've also spoken up on hearings that the task force has had, parents are very concerned that, you know, our special needs children are falling farther behind because accessing virtual learning is not as easy for them, and they need that one-on-one instruction. So to the degree that the Fairfax Public Schools can increase the one-on-one instruction for special needs children, that would make a big difference. I'm sure it'll make a difference for all kids, but that's a category that has been identified as a vulnerable category.
Yeah, and I think even in the guidance that was, you know, issued by the state, and you know, the information that we're seeing, we're certainly very aware of the fact that our youngest students are having the most difficulty with distance learning, our special needs students, our English language learners, and those are groups that we're going to really have to take special care with when we get back to school in the fall. One of the things that we did also in our budgeting process, which was interesting this spring, considering that, you know, we didn't quite have the budget that we thought we might have, but we did, as a district, definitely prioritize, you know, additional counselors, psychologists, social workers, et cetera, in our budget to try to take care of some of these you know, social and emotional needs that we are expecting, you know, all of our students to be dealing with, and even some of our staff. We did put some additional special education staff in some of our more needy schools as well, you know, to hopefully help us deal with some of these issues. So, but those, I am very happy to, if I can get those specific questions from Julia and, you know, get back to people with more specific information about what we're doing for children with the IEP.
Before the COVID-19 crisis, and the state had to redirect dollars, you know, to help with an emergency safety net, and of course to help with increasing access to health care. We did have dollars in the budget that would have reduced the ratio of counselors to students. That money was unallotted, but we're going to wait and see. We're going to go back for a special session at the end of August, and I'm hoping that because of the CARES money, that we will be able to restore some of those counseling dollars. I can't make any promises, but it certainly is a need, and we would, you know, we're going to do the best we can, because we want our schools to have the resources to serve our children. Are the high school students more challenging to get back to a more in-person schedule? Because for lots of reasons, I guess, they have more comprehensive extracurricular activities, and they also take more classes. So are we going to have any special challenges bringing our high school students in for in-person learning?
So, you know, absolutely. I mean, scheduling will be, you know, more difficult in that situation, and we'll just have to see, you know, do our best to work all of that out with keeping the social distancing requirements that we have in place. I've got lots of constituents that are very, very anxious to have high school sports start up again. So, you know, we'll be, you know, watching that information from the state very closely. I know our, you know, our director of student services, you know, at our county level is working very, very closely with the state to see, you know, how we can start getting our athletes, you know, back to work. So we'll see how that goes. But, you know, a lot of our schools are crowded to begin with. So, you know, if we do go back with social distancing, you know, it's going to be a challenge. to figure out how to fit everyone in where they need to fit in, no matter what grade level we're talking about.
Yeah, there definitely will be challenges. Julia, do you have another question for us?
I do, and it's another very specific one that, okay, so this one is about the topic of restraint. What is your plan to prevent students and staff from catching COVID-19 during a physical restraint? And specifically, how do you plan to protect students with disabilities and maybe students of color who are disproportionately impacted when it comes to being restrained?
Before I turn that over, I'm going to ask Ms. Coy. In 2015, I passed legislation directing the Department of Education to come up with a regulation that would minimize the use of seclusion and restraint and to conform with federal guidelines. That regulation still hasn't been signed, so I'm wondering where that status of that, and then I'll turn to Ms. Tholen to actually respond.
Yeah, so I'm happy to provide a quick update on the seclusion and restraint regulations. As the Senator mentioned, these have been many years in the making. They have had a lot of input, as you can imagine, and are critically important to protecting the safety of our students and making sure that the policies we have as a state through these regulations and holding our divisions to the same standard are really updated and appropriate. Those regulations are in their last stage. They go through many iterations and receive lots of public comment and review. They're pending signature by the governor, and I am hoping that we will have something to share on that soon, but they are not yet signed. So they're pending the governor's review, final review.
We're all very anxious, and there was money, not in this cycle, but the previous cycle, there was what, $500,000 for training.
Yeah. And there is training that is forthcoming along with that from the state to do some regional training for different partners and divisions on those regulations to make sure that teachers and staff are equipped with the latest and best information about, again, kind of appropriate policies and procedures in alignment with those regulations.
Okay, we'll keep our fingers crossed. I'm very anxious. It's been a long time since 2015.
Yes.
Okay, Ms. Tholen or Elaine, did you want to respond on?
Sure. So, I mean, without COVID-19, of course, the issues around restraint and seclusion were big for our school district as well as, other districts across the country. So let me just mention that it's interesting timing, but we, one of the school board committees that I serve on is our Audit Committee. And one of the things that we are in the process of doing right now is getting consultants to do a comprehensive review of our entire special education program. And so, of course, procedures and things around restraint and seclusion will just be part of that review. We're doing this overall comprehensive review. So moving forward with planning for COVID-19, it's difficult enough to make plans for, a classroom, that would have, normally, 25 kids, and now we're only going to be able to have 12 kids, et cetera. But we have so many special situations like, people are asking about. And so, we're having a lot of discussions, and John, maybe you can even jump in here on this too if you've got information from the task force, but a lot of discussions around how do we deal with these special situations, and both for the students, for the families, and for our staff in those situations and trying to keep people safe. We will definitely, I just want to stress, we will definitely be offering virtual learning for families too that decide that they're not comfortable with, the school's ability to keep people social distanced or to keep them safe. And we will have that option, available to families and staff. So people can keep that in mind. But I totally understand it's difficult, and we need to get some very specific information out to people about what we're going to be doing. So John, I don't know if you want to add to
yeah, I think that's a very important point. There is divergence of opinions at times, whether attendance at some point needs to become mandatory. But I think the whole focus right now is trying to have flexibility and address people's concerns, to also address fears as well, and understand that we need to keep people safe, but we also need to make people feel safe. And sometimes they're not at the same place. And, I think in terms of special needs, there's been lots of discussions for those students who have special needs, and how do we address that? It becomes much harder, with some of the public health practices that we have. But, the aspect of the different measures that we're using, someone has compared to them, each one of them is Swiss cheese in a way. They all have some holes in it. But when you layer them on top of each other, it does work more effectively. So I think it's going to be that balance of the different measures while trying to balance safety and education. But that's when it comes back to knowing the science and knowing where the greatest risk is, and developing the policies and strategies from there.
There's a question that came in about guidelines for sanitizing and cleanliness. Will the task force be issuing guidelines? A parent is, worried about what guidelines the school systems will be following, and then whatever guidelines should be followed at home, I believe.
So as part of even what was issued by the state this week, there is a document from the CDC that has very strict guidelines for schools. And I believe that includes very specific information. Holly, you can maybe talk to this better than I can about cleaning and things like that. So our facilities staff, I actually was just on the phone like 10 minutes before we got on this call with the gentleman that runs our facilities and maintenance group, and they're just scouring through all of those guidelines for information on the best way to clean our buses between bus routes, the best way to clean classrooms between groups of kids moving in and out. So and looking very specifically at what types of cleaning supplies can be used under different temperatures and things like that. So they're looking at very, very specific, ways to do this in the safest way possible.
Holly, did you?
Nothing really to add there, but our guidance aligns with the CDC guidance on that. We have a comprehensive document that we issued along with the phase guidance that doesn't answer these questions for divisions, but tries to identify the key questions to be asking. And so we're hoping that resource is helpful as these decisions are made at a local level. And in Fairfax County, that's on a huge scale. That alone is a massive undertaking. And so, Elaine, really appreciate your leadership and the leadership of your colleagues in tackling what is a massive operational change. It's not insignificant.
It's our largest school system in the state. And how many in the Fairfax public schools now?
About 189,000.
It's a large school system.
Big.
We probably have time for 2 more questions, so I will let Julia select the questions.
So I feel like we should just go in order, to be fair, but what provisions are being made for students who have a computer or laptop but don't have great access to Wi-Fi?
Yeah, that's
So we've been working really hard on that. I have to say that's one of the areas I think Fairfax County has done a reasonably good job. We have issued, I should remember the numbers. I just had them at my fingertips the other day. We've issued over 22,000 laptops.
right.
And we have, and we've issued about 2,000 MiFi devices. So we also, as part of our looking at how to use our CARES grant, we are purchasing an additional 22,000 laptops that will be primarily issued later this summer to 5th and 6th graders in our Title I schools. And our school staff, I mean, the conversations I've had with our school-based staff have been amazing in that they, over the spring, have put together, teams, they've teamed teachers that speak different languages with other teachers to try to reach out to each and every student and find out what kinds of barriers any particular student may have to participating in distance learning in the case of this spring. And if it is a situation where they have problems with access to the internet, we've been trying to get those Wi-Fi devices to those families. Teachers have been reaching out through emails, texting, calling on landlines, just doing the best job they can to get a hold of people. If you are a family that needs a Wi-Fi device or a laptop, or have other kinds of barriers that you're dealing with, please contact your local school. The administration there is prepared to help you, get a hold of these devices and things that you need.
That's really important. Fairfax was the only jurisdiction, I believe, in the Commonwealth that got direct money from CARES because you have more than 500,000 individuals residing in Fairfax, which the other
we're very appreciative.
The other jurisdictions are getting a pass through of CARES money from the state to help with technology. Do you have any dead spots in the county? I mean, do your children have access to broadband everywhere? Or
I should know the answer to that. I do believe we have some areas that are problems. But I can't tell you where they are.
No, that's okay, but it is an area that we need to look at, and hopefully if the HEROES Act passes, which is another stimulus package that Congress is working on, there should be some broadband dollars. And also the governor, this is one area that he did not unallot dollars. So there will be a significant increase in state dollars available for the expansion of broadband. Just
we've also been doing things like our IT department very carefully maps internet availability across the county. So one of the things that we worked closely with the county to get the libraries, even before the libraries reopened, we worked with the libraries to make sure that their Wi-Fi was turned on so that it was available even when the libraries were closed. So we had instances of some staff members that live in very, rural areas or areas where it's hard to get on the internet in their home. I've heard stories of them, in the library parking lots, doing some of their work, or, at the Starbucks or something like that. But anyway, our IT department is really good about mapping across the whole county that availability. We've even looked at, putting Wi-Fi devices on buses, on some of our school buses, like maybe even our new electric buses that we're expecting for the fall, as and we could park them in strategic locations so people could access Wi-Fi that way. We're looking at so many different options around that.
I'm glad to hear that. One last question. Go ahead, Julia.
To what extent is FCPS considering treating schools differently depending on the infection rate at a particular school?
John,
So,
is your task force?
John, do you know what?
I don't know about that. I do think that, we have been talking about flexibility of the district. I'm not sure if that translates to the schools. It's a good point though.
Yeah, it's a really good point. And I have seen that come in from a number of constituents on emails. So I've been forwarding those, to our staff people. And I'm keeping my list of questions that I'm very curious about for the work session that we have on Monday afternoon. And that is one of my questions I've got at the very top of my list, is how are we going to look at situations, even a little bit more broadly than that, like John was talking about criteria. How are we making decisions moving forward? Well, what are we going to do? What are our exact procedures if we have a positive COVID case, in any particular school, in a classroom, or in whether it's a student or a staff member? What is the protocol that we'll be following? So
Okay.
we'll definitely be working on that.
We have time for closing remarks. Kathleen, you're.
No, I just asked Eileen to keep us posted. We're interested in what comes out of that. But thank you, everybody.
Absolutely. Holly, is there anything we should look forward to in terms of additional state policies?
Nothing of particular note. Just to John's point earlier, this is iterative, and as we learn more, as the scientists and doctors learn more, we'll pivot and adjust as need be. And so while that's not doesn't provide the clarity and certainty that we as parents all want, we are trying to adjust as we need to, given the realities we're facing, as I know local leaders are too. So thank you for this opportunity to share a little bit about the state's perspective.
Thank you, Holly. We appreciate you being with us. John, do you have any closing comments?
No, I think it's, everyone's trying the best that we can, trying to stay informed and involve the public input. So I appreciate the opportunity as a parent, to be involved.
Thank you. And Elaine, I'm going to ask you to close us out so you can give the resource sites where parents can go to understand the process more and to contribute, and whatever other information parents should access. Just make sure that you can actually tell us the website, and we'll get it posted on every Facebook and social media outlet we can find. Go ahead.
Okay, great. First of all, thank you very much for having this. I just think the more opportunities we have for the public to hear, what we're working on, to ask questions, et cetera, the better. So I'm looking forward to the next couple of weeks as staff is giving us a few more, solid ideas of, what might work for Fairfax County Public Schools, and the public input opportunities that we have. Probably one of the easier ones to remember is our, return to school at fcps.edu email that, people can send questions, comments, et cetera, to. We do have a return to school. If you go to fcps.edu to our main website, there's a return to school web page, and that already has a number of presentations that the superintendent has made, has all of the dates that I just mentioned to you on our public hearings, our school board meetings, etc. So, just go there and check it out. I'm trying to get information out on my Facebook page.
Okay.
You just search for Elaine Tholen, Dranesville School Board Representative. It's out there as well. I just want to thank everyone for input and questions and, thoughts, and letting us know what's, foremost in your mind as we're moving forward with this. And, like I think John mentioned earlier, it's not easy. We don't have all the answers. Holly's mentioned, we're all trying to do the best we can with the data that we have. And we will move forward, and things, we're trying to be super flexible. Things are going to change as we move along, and we're hoping to build something that can be flexible and help us deal with any situation that comes our way as far as moving from phase to phase. We just really appreciate our community working with us. Thank you.
I just want to say thank you to everybody who's on the call, for all our participants, listeners, parents, and school administrators, and the entire community. We are very supportive of education here in Fairfax, and we try to work with each other in a collaborative way to actually provide the best education we possibly can, a world-class education to every student here in Fairfax. So thank you so much, and stay tuned.
Thank you.
Barbara.
Stay safe.
Thank you, everyone.
Stay safe. We're in this together.